Hi, everybody. Welcome to another special edition of Litter Media Live. I'm your host, Mike Smith. Our interview today brought to you by Litter Quality Propane. Joining us in studio today, we have Melanie Swisher, Hattie, Tracy, and Dr. Jim Hagen from the Paint Valley ADAMH board. We're going to be talking about their new crisis facility, which is under construction. And we'll be back with that interview right after this from Litter Quality Propane. There's no bill when there's a fill. Contact the Litter Quality Propane today about their metered gas service at litterpropane.com. Our friends from Paint Valley ADAMH back with us. Melanie, good to see you and the gang.
Thank you. Thanks for having us.
I think one of the last times that we had you in, we were talking about the concept of this crisis facility.
Yeah.
It had a different location planned. That didn't pan out, but it is under construction now out near the Pioneer School off 550.
Yes.
Tell us more about that.
So they are moving dirt, and we're hoping in a couple of weeks we're going to see the foundation start to get laid. I am thinking that probably it should be done by May or June, but you know how construction is.
Right. Yeah, we're having a kitchen redone right now, so I know all about that. And about the crisis facility itself, what will it do for our community?
Okay, so it's going to have 8 chairs and a 23-hour OBS. And by the way, Hattie's with Coleman Health, so her agency will be providing the services. They do crisis work all over the state. Gotcha. And then it's going to have a crisis stabilization unit that will have 8 beds. So if somebody comes to the observation unit, and maybe they really don't need to be in a hospital, but gosh, going straight home and waiting for an outpatient appointment isn't going to cut it either. They could go to the crisis stabilization unit. They'll have somebody there all the time. They'll have just increase in services. Our mobile teams, which Hattie's going to talk more about, will be operating out of there. And plus, people will be able just to walk in the front door if they just need some mental health help.
Is this, Hattie, kind of like an emergency room for mental health?
Yeah, absolutely. It's similar to what the state is calling their behavioral health urgent care models, so that people can come in and have access to nursing, counseling, psychiatry services, and get seen in a trauma-informed way to make sure that their immediate crises are addressed, and that we can try to wrap services around them and send them into the community versus having to hospitalize them due to lack of resources.
Now, I believe there was a big grant that came to help with this construction, correct?
Yes, we received an ARPA grant of almost $8 million to help build this.
And the staff numbers, Hattie, what are we looking at there?
I believe we are looking at around 30 to 40 staff that we would be hiring.
And this is 24/7,
yes,
correct?
24/7.
Now, we're going to give a grand introduction to Jim down there as to why Jim is here today.
So I am super excited that our board decided to name this facility after Dr. James Hagen. For those of many people in our community already know James Hagen, probably needs no introduction, but he started crisis services in this community over 40 years ago. And has just left an indelible mark. And so we wanted to honor him. He's been a big advocate of these services.
I have been.
Jim, this was probably just a dream for you 40-some years ago.
Yeah, somebody once said, that's odd, they're going to name a building after somebody who's still alive.
You don't put memorial with that.
You don't. I came to, I was in Kent State University in 1970 after serving, after completing my undergraduate work. And that was a few months after the shootings in May 4th, 1970. And the university was going through this crisis, as you can understand. And they were offering a mentoring program for incoming graduate students. And so I chose a person who was named Dr. Dick Reinierson, who was also a part-time faculty member, but also ran the crisis center, the counseling center at a university. And they were setting up a crisis telephone unit on campus. And I went through the training and became one of the paraprofessional volunteers as a graduate student. And then I began assuming some of the training roles for the counseling center. And that was my introduction to crisis work. And then after completing my academics there at Kent State University, I went to an open door facility in Indiana, Pennsylvania. And Indiana, Pennsylvania was a town that had a crisis center that already established, and they were looking for a director. So I assumed that job, and I held that job for a number of years. And then I began to search for other work. And I ran across this ad for Propane Valley Mental Health Center, who was establishing a crisis center, which had been funded by a tax levy, but had not been established yet. And so I took that job, and I established the crisis center here in Chillicothe. And then I left the Propane Valley Mental Health Center, and I worked for Adena Counseling Center for a period of time as a psychotherapist. And then I retired briefly in 2010.
Jim, from what you've seen with Crisis Center, doing the best you can with what you have over the last 4 decades, how is this new facility going to transform what has been done?
Goodness gracious. Well, part of what I began doing as a psychologist was doing forensic evaluations for the courts, local courts here, municipal courts. And law enforcement understands who are the mentally ill walking the streets out there, and they arrest them for minor misdemeanors, criminal trespass, and menacing threats, so on. So it will save the courts the time and costs of, it will save the county the jail time. These people serve time in jail, and after they're arrested. And so I think what law enforcement can provide is a means for dealing with these mentally ill folks who are committing minor misdemeanors on the streets. It'll save the courts time and money. It'll save the county time and money, because the law enforcement officer can pick somebody up who they know is mentally ill, fill out a 1-page pink slip, and admit them through a sally port, which is locked, to the crisis unit, and then they can go back on the streets. So it'll save the courts.
It's my understanding this is not intended to be a long-term facility, just if you have a crisis situation that needs dealt with now.
So right now, somebody would go to the ER, and the ER is there for a lot of physical needs, so it's not ideal. They wait for hours sometimes. When they come to the 23-hour OBS, they're going to be working with behavioral health professionals. So in those 23 hours, the crisis will either resolve, they'll either help them get to an inpatient psychiatric unit or crisis stabilization unit. But we're going to get them where they need to be.
Hattie, Jim mentioned how that would work if law enforcement brought somebody in. Can a family member call and say, hey, I have someone that needs crisis help? Does that work also?
Yeah, absolutely. I mean, we have a mobile crisis services, adult mobile crisis services that we're providing in Chillicothe right now. So right now, families could call and we could send our adult mobile staff out. We could send our mobile response and stabilization team out, which is focused on youth services. So not only will they be able to come into the facilities, family members could bring them to the facility. Family members could call and we would go to meet them in the home and address the crisis right then and there and make a decision. Do they need to come back to the facility, or can this be managed on an outpatient basis? And can we provide those services to those families? So it is not just for law enforcement or EMS. Individuals can walk in, families can walk in, but they can also call, and we'll still continue to provide the mobile response in the community as well.
I believe the governor had a presser on that 2 weeks ago or something, announcing something about this mobile unit for the state of Ohio.
Correct. Yeah, he did. I think it might have been on April 21st that he announced the regional management providers for mobile response and stabilization services, and Coleman will be that agency for this area. And so we will be working to set up the mobile response and stabilization services for the Paint Valley area.
Other than facilities like this new crisis center, Jim, what are some of the ways that we've had to deal with people in crisis in this regard over the years. How have you, your people, your business, how have you tried to help these folks?
Well, it's available 24/7, and it's available 24 hours a day. So a person can pick up the phone and anonymously call the crisis center and receive immediate crisis stabilization services.
Which would be connected in a way, I guess, but not directly related to the crisis line, or is it directly related?
Well, it's related to the crisis line.
Yeah.
The crisis services at Scioto Paint Valley Mental Health Center are 24/7 service, 24 hours a day.
Because sometimes people just need to talk to somebody. They don't need to come in. They just need to talk to somebody.
Absolutely, yeah. And a lot of times the incident can be resolved through a phone call if it's minor, if it's something having to do with anxiety or depression or suicidality. But the crisis center will offer the intensive services that are necessary sometimes on a face-to-face basis with the Komen group that can be more effective telephone call.
Now, does this center represent just Ross County, or will other people from surrounding counties be able to access this too?
The Paint Valley ADAMH Board serves 5 counties, so Highland, Pike, Pickaway, Ross, and Fayette.
And you said you thought it would be completed by approximately when?
It's supposed to be completed by the end of April, but
Next April, yeah.
yes, 2026. So I'm thinking by like June of 2026 would probably be safe.
Right. Yeah, I go home that way sometimes. I live in Frankfurt, and I'd seen them moving dirt, and then finally the ADAMH logo appeared on the sign. I thought, now I know where we're going with that. So that's why we have them here. If you've been driving by that and wondering what is going, that's why we're here talking about this today. Anything else about the new crisis center, or anything else dealing with ADAMH that you want to discuss here today?
Yeah, I just, they had talked about the crisis line. If you're in a behavioral health crisis, or if someone you love is and you're not sure what to do, it's 988. Just call 988. They will help you. They do a great job. They can point you in the right direction, get you the help that you need. So don't ever be afraid to call 988.
Has 988 replaced what used to be the local number for that?
So currently the local number still works, but they go into the same place, and we're really trying to promote the 988. That's a nationwide line. We're fortunate because we have a local provider picking that line up.
Right. Okay. Had anything else you want to add?
No, the only thing I would add is that you can also text or chat 988. It does not necessarily have to be a phone call. So if you don't feel comfortable making that phone call and you feel more comfortable with sending a text, that's also an option for 988.
Jim, I guess congratulations. You put in a lot of hours, a lot of days, weeks, months, years, dreaming about this, and finally, here it comes.
It's here, and I'm so grateful to the ADAMH board for establishing this. It's been needed for a long time.
He's a pioneer, isn't he?
Yeah, we're grateful for him.
We appreciate you. Thank you very much. Again, our guest today on our special edition, Melanie Swisher, also Hattie, Tracy, Dr. Jim Hagen, who this new crisis facility will be named in honor of, not in memorial. Our interview today brought to you by Litter Quality Propane. I'm Mike Smith.